Oh, I think my urine leaked.
I just can't control my urine.
I can feel a part of my vagina coming out.
You have a weak pelvic floor. 1 in 4 women suffer from these symptoms. So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So today we will be talking about exercises which every woman must know. These are pelvic floor exercises, commonly known as Kegels exercises. So let's understand first what is the pelvic floor. Before that, what is pelvis? So pelvis is an area between your 2 hips. This basically supports your bladder, uterus, vagina and the rectum behind. So the pelvic floor is the floor of this pelvis. This basically consists of muscles and tissues which sort of form a sling or a hammock which supports all these structures. In women, this floor is perforated by 3 openings. The urinary opening in the front, then the vaginal opening and then the anal opening. So why does the pelvic floor becomes weak? The pelvic floor could become weak because of pregnancy, childbirth, complicated vaginal delivery. Somebody wherein the vacuum delivery happened, maybe the forceps delivery happened. Somebody who's overweight because there's so much of weight down there. Or simply because of aging, menopause, somebody who's chronically straining down there, somebody who's having chronic constipation. Some cases, prolonged sitting, even sexual abuse, genital trauma can also lead to a weak pelvic floor. So what happens when the pelvic floor becomes weak? So a weak pelvic floor in most of the cases can cause what is known as urinary or anal incontinence, which means that you are unable to hold your urine or the bowel. You cough, sneeze or laugh and little bit of urine comes out. Some people are not able to control the passage of the gas also. You may feel little pelvic pressure, little heaviness down there. Post-delivery, a lot of women complain of vaginal laxity or loose vagina. So the exercises to strengthen the pelvic floor muscles are known as Kegels exercises. These are very specific exercises to strengthen the pelvic floor. Now the pelvic floor muscles are hidden deep inside. They are not visible from outside. They do not have a movement like our hand movement. So most people are actually very clueless as to how to identify the muscles, because it's very important to identify them correctly. Only then you will be able to exercise them properly. Now these are the muscles which are typically present around the urinary opening, the vaginal opening and the anal opening. So now let's first learn how to identify these muscles correctly. Identifying the muscles around the urinary opening, the urethra. So you can identify this muscle by trying to stop the urine flow midway. Imagine if you're in the bathroom passing urine, somebody knocks at the door and you suddenly stop in between. That's the muscle. But it's not a good idea to start and stop the flow of the urine in between frequently, and also do Kegels exercises when you are full bladder. Remember, inadequate or incomplete emptying of the bladder or doing Kegels exercises full bladder can actually cause increased UTIs. To identify the muscles around the vagina. So for this, Just try and squeeze the muscles around the vagina as if you are trying to close the vaginal opening. At the same time, try and pull the vagina up towards your navel. Imagine there is a string at the top of the vagina and you're trying to pull the vagina up towards your navel. While you're doing this, you might feel a little tightening around your anus. You might even feel a little tightening in your lower abdomen. That's all right. Just focus on the vaginal area. Muscles around the anus. For this, simply squeeze the anal opening as if you're trying to stop the passage of gas or trying to stop the urge to pass the motion. You will actually feel pulling sensation in your anus and the rectum. Just make sure that you're only squeezing the muscles around the anus while the buttocks are relaxed, and try and squeeze and pull the anus up towards your navel. So now let's do the exact steps of Kegels exercises. Number 1, empty your bladder before you start the Kegels exercises. In the beginning, try and find a quiet or maybe a private place. You can do these exercises in a sitting position, standing position, lying down on your back, on your abdomen, on the side. Actually, any position is okay for doing Kegels exercises, provided you can identify the pelvic floor muscles correctly. We spoke about how to identify them correctly. Remember, this is the most important step. So make sure that you spend some time identifying that. In the beginning, you might find it very frustrating. You might feel that I'm not able to understand, but please spend some time in identifying those right muscles. So for today, let's do this exercise in a sitting position. So sit up tall, straight, with the shoulders relaxed. Squeeze the muscles around the anus and vagina. See if you can also squeeze the muscles around the urethra. Hold the contraction for a count of 3. 1, 2, and 3. And now slowly relax. Take a deep breath in and relax. While holding the Kegel, it's important that you continue to breathe. Now let's do it once again. Squeeze the muscles around the anus, vagina, and the urethra. Hold it for a count of 3. 1, 2, and 3. Slowly relax. Take a deep breath in and out. In the beginning, just do 2 or 3 Kegels only per day. It's important to get the right technique. It's important to engage the right muscles. See if you can hold the Kegels for more than 3 seconds, maybe 5 seconds, maybe up to 10 seconds. Slowly and slowly, you can also increase the number of Kegels exercises to 10 repetitions. So remember, every day, 3 sets. 1 set is 10 Kegels, holding each Kegel for 10 seconds with a gap of 10 seconds in between. There are some quick lift Kegels exercises also. So for this, you just squeeze tightly the muscles around the anus, vagina, and the urethra and relax. Once again, quickly and strongly squeeze the muscles around these 3 openings and relax. So brisk and quick. So squeeze and relax. Now these quick exercises actually help to train your pelvic floor muscles to stop those unnecessary leaks when you are coughing, sneezing, or laughing. So try and incorporate these quick lift Kegels also, 5 to 10 quick exercises at least 3 times a day. How do you know that you're doing your Kegels exercises correctly? So if you have pain in your back or in your abdomen after doing Kegels exercises, this means that you are not doing it correctly. Remember, even when you are engaging your pelvic floor muscles, the muscles in your abdomen, back, sides, or buttocks should remain laxed. Another easy guide is that nobody else should be able to make out that you are doing something. Internet is actually full of exercises claiming to be pelvic floor exercises. For example, a bridge. Now, a bridge is a wonderful exercise, but it is not a Kegels exercise. Remember, any exercise where there is movement which others can see is not a Kegels exercise. So, who should do the Kegels exercises? Every woman must do the Kegels exercises every day. Make it a part of your daily routine. As the time goes by, you can do these exercises anywhere, sitting in home, watching a movie, relaxing on your couch, working on your laptop, in the park, in the movie hall, sitting in the car. You can do it everywhere. Kegels work best when you are trying to prevent the pelvic floor problems. Remember, once the pelvic floor gets damaged, once you have a severe urinary incontinence or a severe prolapse, Kegels exercises will no longer be helpful. Unfortunately, there are some exercises which are underrated or underestimated. People don't go looking for them unless and until there is a problem. Unfortunately, Kegels exercises are one of them. So don't make that mistake. Start your Kegels routine early in life and you will never regret it. So once again, today if you found this information useful, please subscribe to Maitri by pressing the bell icon. You can also subscribe to Maitri by pressing the icon at the right hand bottom corner of the video. Also share Maitri with your friends and families, and do not forget to follow us on Facebook, Instagram, Twitter, and we will see you soon.